Welcome to Two Bees in a Pod. I am Bilola.
And I am B. Leonga, and this is a podcast about immigrant experiences in the U.S., sharing our perspectives on various topics,
including straddling cultures, fitting in, staying connected, learning and unlearning the good, the bad, and the ugly.
Welcome to another episode of Two Bees in a Pod. This is a very special episode because for the first time we have two guests. So I'll be introducing them shortly, but as usual, we will get into our icebreaker first. So everybody on this episode went to boarding school. So the icebreaker this week is share a boarding school life hack that you used as a student. So Anna, you can go first.
Wait, we all went to the same boarding school, but
What person? One straight person is here.
I think like the life hack would be, and I used to do this when I had friends that were older students in my dorm that liked me. I'll fold my clothes and put it under. I had two mattresses in Form 4, so I'll put it under both of them to make my dress, to make the lines on your uniform. So that was a hack that I used to do.
I did that too. To iron your clothes, basically, right? You put like the cardboard under, and then you put the clothes. Okay. Bilola, you were chomping at the bit before we started recording, so you can go next.
I want to give a disclaimer that my hack is going to make me sound like I was stingy, but it was survival of the fittest. So I learned how to open a tin of Nido without breaking the seal.
Wait, explain that. Well, for the listeners who are not familiar, Nido is a powdered milk.
Milk.
Just for context, yeah.
And it came in a tin, and it had Nido, and it's very specific, right? It's Nido, not Peak or any of the other options, because Nido had a plastic seal. Mm-hmm. And I learned how to open it without breaking the seal. That way somebody say, hey, please for milk. I'm like, sorry, it's not open. It was open.
And you show them.
You just, I showed the seal. And I would say, and bonus is making friends, with people. I don't know if this was intentional or by design. I did not like doing laundry, and for 6 years in boarding, 7 actually, somehow I was always able to make friends with people who like to do laundry. So for most of my time in boarding school, somebody else washed my clothes.
That's
likes to do laundry.
I had a friend, her only requirement was I had to carry water and keep her company. And I
can tell you, girl, that I used to love laundry, yeah.
Wow. Okay. Mm-hmm. Nina, what about you? What's your boarding school life hack?
Definitely was not doing laundry. Definitely was not putting clothes under the bed as religiously either. So as we were talking about it, because before I didn't have a hack that I could think of, but I just thought of something. So when I got to a certain class, I might change my bucket from like just the regular bucket, like the metal bucket, to the plastic bucket that had a lid. So you could put your water and then you could put a lid over it. So, and the reason I liked that lid was when you went to bathe, you could use it as a scooping, like a cup, to put the water on you. Because it's so early, so cold, you don't want the water on your body so quickly. So I'll use the lid to like scoop the water and then throw it on me. Or sometimes to like put things, like soaps and sponges and different things on the lid.
That's a good one.
I have a question.
Yes.
I just have one question. Because people went to school in Limbe, and for all intents and purposes, Limbe is warm. So what is this cold you are talking about?
Please.
6 a.m. in the morning is cold.
It's cold.
I think Douala is cold.
Yeah, 6 a.m. is cold.
Anywhere that's not Douala was cold.
Yeah.
Yeah.
I mean, compared to Bamenda, sure.
No.
But the Northwest is like particularly cold in the morning. Like you guys probably even had a little bit of precipitation.
Harmattan. Have you experienced Harmattan cold?
It was on top of a hill, and then right across was so the breeze was kind of cold because
that
sounds like a good time. Again, with my experience being in Bamenda in the hills, that sounds like a good time.
So Nina, you just actually made me think of one when you were talking about the bathing water in the bucket. So, and this works very well if you have a metal bucket. So in the afternoon, right? Like Nina was saying, we didn't like to take cold baths. So if you put your bucket under the sun, and it doesn't take long to get warm, you will have a nice, warm, sometimes hot bath. If you just leave your bucket of water out on the lawn to get warm, then it heats it up.
Guess what? Another one is in Form 3. If you make friends with the people in the kitchen and you're a kitchen girl, you get warm water in the morning.
Yes. Yeah, because they used to boil water for tea. Yep, so you could go
Yeah.
and get.
I had zero idea that was a thing.
What? Yeah.
Yeah, I didn't know that was a thing. That you could get warm water from the kitchen.
Honorary mention. I never did this, but like an older girl told me, I was talking with her one day, and she was like, oh, she hated, washing her underwear because normally, like when you get up in the morning to go take a bath, like you would have to wash your underwear before or most people did. Like, yeah. So she was like, no, I would just sleep naked. So I didn't have anything to wash in the morning. I woke up.
A question though. Because didn't we shower? At least we showered, went to dinner, went to evening prep. So where's the underwear from that time period? She washed it before bed?
I think she meant if she showered before bed, then she would just sleep naked. So that she didn't have to dirty a pair of underwear.
Y'all showered before bed. That's different.
It
but
depends. Senior girls.
Yeah.
It depends. I think it depends on your schedule. If you had, for example, chemistry lab instead of siesta, then your day could kind of just run in to night prep. Yeah. And then by the time you're coming down, yeah.
You guys went to an all-girls school, so I feel like there are liberties you could take that those of us who went to co-ed schools could not attempt.
I mean, but you're still in the girls' dorm. It's just,
No, but I'm saying, maybe if she went commando or something else, right?
Oh, up to prep commando. Yeah. In college, now we're going off on a tangent as usual, but in college I had a friend who we would go out to the bar and she would wear her jeans without underwear because she was like, I don't want to make laundry.
Still have a friend that does that.
I just feel like it's uncomfortable.
Very, very uncomfortable. That seems like a yeast infection waiting to happen.
Oh yeah, so it's not like you're washing with your hands anymore, right? So
that's what
I get it, not wanting to do laundry in boarding school, but now what's the point?
Anyway,
saving laundry.
I still don't like laundry. Just the washing, laundering, folding, putting away, still a process.
Yeah.
But it could be worse.
Could be. All right. So who are these guests that have been giving us these life hacks? We have Anna and Nina, and I'll introduce them and allow them to introduce themselves. Anna Foncha, she's really going to be the storyteller of our episode, right? She's here to share her story on her journey recovering from cervical cancer, what that experience was like. And in September, we were talking about grief a lot. So we'll come back to that topic when Anna shares her experience. And then to give us a professional medical opinion and share some insights, we have Dr. Nina Loom, who is also joining us. So I will start with Anna. Thank you so much for joining us and for raising your hand to share your experience, which I'm sure, took courage, but we're happy that you're here. And I know that people benefit from hearing your story. So please give us a brief intro. You're obviously Cameroonian. Well, maybe not obviously, but you are. So tell us, what brought you to America?
Yeah, hi. So I'm Anna. Thank you for introducing me and thank you for having me here. I do watch your podcast and I absolutely love all your guests. And I was just really moved with the topic of grief by this, because this type of grief is not what people would expect. But anyways, I'm Anna. I'm from Cameroon, born and raised in Douala. I came to the US 2005. Well, that's mainly because, my dad and his siblings did go to school here. And I think it was always you come back to school when you go to school here. So I came here for my education, like most people.
And that's how
most of us. I'm in Atlanta, Georgia. I went to school here. I went to high school actually here. I came here in the 10th grade. And then I went to college here as well. So
I didn't know that.
Yeah,
Ajaba Pikin. I didn't know that you went to high school here.
No, I think it was not really a choice. Of all my siblings, I'm the one that came here a little early, and I think it was just middle child syndrome. That's probably what happened.
Or I have an alternate version of why Anna came. So I'm putting my family business out here. my brother and Anna had a thing right around when Anna came to the US, and my darling father maintains that my brother went to visit one time and Anna's dad got scared, and so they sent her to America.
I didn't know knew that. I was
Wow.
shocked, but I'm a child. I didn't know anything. I just
I assumed it was a joke. I don't know if it's serious, but hey,
remember
maybe.
he called at 11 p.m. one night, and I had a whole talk with my parents. Why is someone calling at 11 p.m.? But let's digress.
I feel like there's just so many things about this call that I'm realizing we're never really in the same
We're
area
not even the
at
same
any point in
life.
time. We're not even the same. Like we never went to the same boarding school. I never grew up in the same communities like these other two. Like we were different.
Our other guest is Dr. Nina Loom. She's a medical doctor and the founder of the IMG Roadmap. Nina, can you please introduce yourself? Give us a little bit about your medical training and also what brought you to America.
Lord came for greener pastures. Like I'm just going to say it how it is. So yeah, I'm from Cameroon as well. Born and raised in Douala, like some of the other ladies. I moved to the States as a medical student, actually. So very different. Came in for clinical rotations from the Caribbean, and then just kind of finagled my way into the system like everybody else. So I moved here as a student. And I'm board certified in family medicine and in emergency medicine. I live and practice in Cleveland, Ohio right now. I do a mix of hospital medicine based and emergency room based work currently. I love what I do. When I'm not working, I also enjoy coaching other people like myself who are immigrants, physicians, medical students who are looking to find their way in the system as well, particularly for postgraduate training.
Welcome, welcome. All right. So, Anna, can you please share with us just however much or little you feel comfortable with, how you got to find out that you were diagnosed with cervical cancer, kind of the timeline and any notable events that were leading up to that? Like, were you completely blindsided or what led up to that revelation?
Yeah, sure. First of all, I'm probably going to be one of those African parents that are going to say my kids need to be doctors, because not only before I had, my diagnosis, but during, I was probably medical people, doctors, nurses are probably the best people in the world. That's what I'll say. I think they need really a lot of like accolades in this world. I'll just say that, Nina, I really respect like my doctors and stuff out there. But so with me, I used to be a flight attendant, and being a flight attendant moved me out of Atlanta, and that moved me away from my doctor. But I just usually have my regular pap smears and stuff like that. But I was out of Atlanta for about 4 years, and let me not lie, I didn't get a pap smear then. But also at the time, I want to highlight that I was aware that I was supposed to get my pap smears every 5 years. So that was the notion that I had. Like, I was like, that's what I was told. So when I moved back to Atlanta, I moved in with, someone I was dating at the time, and everything was fine. At the time, I was 32. So in 2021, I started experiencing spotting. And that I usually have very regular periods. I don't skip a day, nothing. That's never happened in my past. But I started experiencing like some spotting, and this spotting was not like old blood. It was like more fresh, but it was very light. So I think I told my friend that's like a nurse at the time, and she was like, it's probably just hormonal changes. You're in your 30s now. And that's all she was saying, So I didn't think anything about it because I didn't experience any pains. Like there were no pains. But also at that time, when I think about it, I also started noticing I started gaining weight, but I didn't know why. At first I was like, okay, maybe it's just the way I'm living my life. I'm still drinking and things like that. But then I started having back pains, but I was like, okay, maybe that's me gaining weight. But I think all of this kind of like trickled down to like, it made me understand why I was even experiencing that. But that was happening. I kind of ignored it. And you know what? The person I was dating, I was really serious with at the time. We already started talking about potential families in the future. So I was like, you know what? It's about time. Let me go have my pap smear. And that's really what prompted me to get my pap smear, with nothing else but that. So when I went there, I didn't really expect to hear anything. I was just like, okay, it's hormonal changes. That's what I went in there with. So I remember at the time I was switching insurances. So I went to a women's clinic initially. And it was a nurse practitioner that did my pap smear. And I'll never forget, every part of this journey is so vivid still in my mind. And I don't know how I recollect everything, but I always experience it over and over every year. I went to her and she did my pap smear, and she told me, she's like, if there's something that's wrong, I'm going to call you and tell you to come. But if there's nothing, I'll just call you and tell you your results. So I was like, oh, okay, cool. I remember 2 days later, she calls me. I was in a meeting at work. I work from home. I work from home. And she goes, please, I need you to come down. And good thing the hospital was just like about 5 minutes from my apartment at the time. So I'm like, so I tell the guy I was dating at the time, like, oh God, I don't know if this sounds good, but I didn't expect anything. I go there and she holds my hand, and she holds my hand, and she's like, I can't tell you what it is, but from reading this, and I've been in the industry for a very long time, this doesn't look good. And I was like, what? And she's like, I'm 99% sure this is cancer, but I can't tell you that. I can't diagnose you, but this is just from the pap smear, the results, and what I'm seeing. And immediately, I think my first reaction was just, I don't think I had any reaction at the time. It was just more like, and I think I asked her again, like, what do you mean? And she's like, I think it's cancer. And in my mind, I'm like, okay, what kind of cancer comes out from a pap smear? In my mind, that's all I was going through. I was asking all these questions in my head. And then I was like, so what next? And she goes, I'm going to send you to do a biopsy with a doctor that I know very well. And she's a Black female. And then I was like, and then she said, from there, that's going to, you're going to know what to do. And then she goes, I'm going to call God a lot in this conversation. She goes, can I pray for you? And again, like I said, this is a very vivid memory. And I said, sure. And then I asked her why she decided to pray for me. And she was like, there's so many women like you that come here and they get scared. Your reaction has been very distinct and they never come back. And they come back when it's like too late. So she's like, I just want you to not do that. So that's kind of like my first reaction and like my first journey and how I found out.
Thanks for sharing that. Something that came to my mind when you were talking, and I don't know if there's different sets of information out there, but I've always been told that I have to get my pap every 3 years. If you have an abnormal result, then you come back like every year. So Nina, can you let us know what is the current guideline? And if it differs by age, what is the guideline for women to get their pap smear?
Yeah, so that's a really good question. So first, what is cervical cancer, right? Cervical cancer is changes in the cell growth within the uterine cervix alone, not the uterus, not the ovaries, just the cervix alone. And the guidelines for checking routinely with cytology is where you go in and they swab your cervix and they put it in a little piece of like liquid and look at it under the lab. So that's one way to screen for cervical cancer. The second way is to do that swab plus testing for the human papillomavirus, which is the virus also known as HPV, that is associated with 99% of the cases of cervical cancer, though you can have cases without HPV, but they're few and far between. So there's cytology, meaning looking at the cells from the cervix, the female cervix alone, and then there is cytology plus HPV. Now, between the ages of 21 to 30, the guidelines have been written in order to, one, determine who gets cervical cancer and when, and to be able to capture the cases early on, right? So guidelines, I should say, first of all, they're guidelines. They're there to guide us. They're not there to mandate how every single person will be screened. And in order to also reduce the burden of the healthcare system, we do guidelines so that we don't overtest people. So that's why for people between 21 and 30, it'll say you should only do, you could only do cytology, which is a pap smear alone, from the age of 21 to 30. Now, between 25 and 30, it is recommended that you could add the HPV testing alongside, and then you can spread it out to 5 years. So every 3 years is the answer for 21 to 30 cytology alone. Every 5 years, if you do cytology, so cell sampling with HPV testing. If those results come back normal, there's no indication to screen yearly in that person. However, if the results come back abnormal at any one point, your individual guidelines change dramatically, and therefore you may have even closer intervals for screening. Over the age of 30 to 65, which at 65, we don't routinely screen anymore. So 30 to 65, then at that point, we do HPV screening along with the pap smear at that initial testing time at the age 30. And then we can narrow it if we have a negative cell screening cytology, negative HPV, then we can still give you a 5-year gap or 3 years, depending on your individual risk factors, or it may even go to annual, depending on what is found on your pap smear.
Okay.
And I want to say that my diagnosis, well, at the time too, it was HPV related. And one thing I didn't ever know was because the last time I had my pap smear, I was fine, right? So when I asked her, I was like, what do you mean? How did I get HPV? And I think Dr. Nina would be best here. And she was like, it's not necessarily like someone you can, it's a skin, you can get HPV skin to skin. And generally, most people do have HPV, but fight it off. But in my case, she's like, your immune system probably just didn't fight it off. And then unfortunately, unfolded to this. Not saying that that's what's going to happen to everyone, but that's how she kind of explained it to me at the time.
And that is so true because HPV is a virus that a majority of the population gets exposed to, even boys, girls, female, male. But for people with the cervix, if we get exposed to HPV, it takes 10 to 15 years for it to convert into what could potentially be a cancer. However, over 60-70% of us will clear it without ever identifying that we ever had exposure to it or ever knowing that we had it. And simultaneous with that, your exposure could have occurred distant in the past. However, the cancerous cells, like you said, because it's going to take a decade or more, or it could take shorter, but on average, it takes a longer time to become cancer that you may or may not know or remember that there was any prior exposure to HPV.
Thank you for that. So, because there is an HPV vaccine, right?
Yes.
So what are their guidelines about, like, what age is it offered and how long does it offer protection? Or is it like a once in a lifetime?
So that's a great question. I started the HPV vaccine series in my 20s because that's when I learned about it in residency. However, so if you've never had the HPV vaccine before, talk to your doctor and see if you're a candidate for it. However, routine age of vaccination is as young as 10 years old. 11 and 12. It's a 3-part vaccine and it's at 0, 4, and 6. So you'll do 3 shots over a 6-month time frame. And you can even start as early as 9. It is also recommended for boys and girls. So it's just not only for people with cervix, but it could be for people who were born without a cervix. And when you start it, now, if you are between 11 and 26, you can still get an HPV vaccine. So even if, let's say, for those of us who grew in different countries that, we're not routinely offered HPV immunization as an option, we can start in our 20s. Now, 26 is the cutoff, at which point there's smaller evidence to support vaccinating over that age group. But it's never too late, even if you're in your 20s, to start to get the vaccine. Yeah.
Okay.
And you know what's funny? I want to also put a side note to that is, in college, apparently, I found out later that it was posted everywhere in college. And this is one thing I would say people need to pay attention to their surroundings. Because when I was in college, apparently I think that's when it became really popular and they were pushing people to like go get the vaccine. But I kid you not, I wasn't aware till that nurse said what she said then. And then I went researching.
Yeah, and there are so many resources for our listeners that are located inside, at least in North America, I would say, the health department in your local area, Planned Parenthood in your local area, several free clinics the CDC, if you're in an area where there's a CDC office or anything like that. If there is a American Cancer Society in your area, you can call these places and ask them for where you can get vaccinations or immunizations at no cost. And there are several programs that would offer it. If you're not in school, you're maybe working or you're in between immigration statuses and different things like that. Like, there are options for everyone. You just have to kind of know where to go. And to add to the vaccination point, for people between 27 and 45, you can still get vaccinated if you want to, depending on individual risk factors. So if you're somebody who says, well, I've known I've been exposed to HPV before, or I have a high risk lifestyle, or I have family history or genetics, you can still talk to your doctor about getting vaccinated, even if you're over 26.
Good points. All right. So Anna, you know, this nurse has given you this news, which I'm sure your mind was going like 1,000 miles per hour. But she refers you to, the Black physician she referred you to, was that an oncologist or OB
It
or?
was now I'm just thinking about it. I don't even know what that doctor was, but she's the one that performed my biopsy. Then she referred me to a gyne oncologist
Oh, okay.
after.
Okay.
So yeah, when because I think I don't think she worked in the oncology sector. So when I went to her and got my biopsy, she sent my results to the gyne oncologist, who was a Black male in like probably Dr. Span is probably like hitting 80 now. Like he had to be like 78.
I love that.
Yeah. I love him. So she sent me over and she really told me like I trust him and he will take good care of you. And he's a Piedmont doctor. So when she sent me over there after my biopsy was done, he reviewed it from the labs and everything. And that's when he said, he looked again inside when I came for the test. He looked inside. He was like, I don't really see I see a lot of like, some cancer cells, some abnormal cells, but I don't know that it's cancer yet. It looks precancerous. So that's what he told me. So at the moment I was really high and I was like, it was like a wusa moment. And this all occurred a week apart. That's how fast I was doing my call, get me in kind of thing. And this was October at the time. So he said that. I'm like, okay, but he's like, I cannot say that, right? But this is what I see here. And he's like, so the next steps will be a LEEP procedure, LEEP. So he's like, what that does is we're going to cut out where we see that cancer or that abnormal cell, and usually it would scrape out everything that needs to be there, and you should be good. So that's kind of what he said, and he was like, but that may also not be the case. The other case is, then he goes, do you want kids? And I'm like, yeah, of course. He's like, okay. There's one thing when I tell my older sister about this doctor, I'm like, I don't think everybody will appreciate him because he didn't really have empathy, this particular guy. He just was very blunt with how he spoke to me. He was like, well, you can't. That's what he told me. If that's not the case, I'm like, what do you mean you can't? Like, he's like, well, because we're going to have to do a hysterectomy, or I'm going to butcher this, but I wrote it down, radical trachelectomy. And I'm like, what's going on here? I was like, why do we go from 0 to 100 all the way? He's like, well, that's kind of how cancer is, depending on the staging. He's like, it's either going to be surgery or you're going to have radiation or chemo in most of the time, with your type of cancer. So I'm like, okay, so what is this hysterectomy? So hysterectomy is when they take out everything, they take out your uterus. Dr. Nina is probably going to explain that better. And you cannot carry a child. Your ovaries are intact. The other one, trachelectomy, that was obviously the one I was leaning towards, because he was like, if you want to carry your kids, we're taking out your cervix, but we're leaving your uterus and sewing it up. So you're going to be extremely high risk, but that works I would recommend that. Now, I can't do it. I'll have to refer you to WellStar. He's like, I can only do hysterectomy. So if you want to go that route, come to me. Like that, he was really just straightforward. So I'm like, all of these things are, and I'm like, all this information. And at the time, the only people that I had told obviously was the person I was dating and my sisters at the time. So I'm like, what is going on here? So I went obviously for the LEEP procedure, just trying to shorten the story. The LEEP procedure happened November 3rd that year. Like I said, I was on it. I wasn't waiting, so he did my LEEP procedure and he was like, okay, I hope everything is fine. If it's not fine, I've already referred you to WellStar, because that's the other option. So at this moment, he wasn't thinking it was nothing more than, if anything, a stage 1. The way he was talking to me was like it was either precancer cells or the most stage 1. So my results came back in November, like around November 16th. And he was like, he called me and he's like, yeah, I should come into the office and stuff. I was like, oh God, PTSD. And then he was like, you definitely do have cancer. Like, that's just all he said. So I'm like, okay. And then he goes, so we can get you right in. We can get you right in to be staged. So I'm confused here. Like, you've already told me I have cancer. What do you mean staged? Tell me what I'm staged. Like, what's my stage? But apparently you have to go through an MRI and scans. So I'm like, at that moment, I had already bought my ticket to Cameroon, not to Joka, but to, but at that point, to me, my thought process, I wanted to give my thought process because as much as I was scared, but I was also very hopeful. And I was like, I don't know how to really express myself, how I felt at the moment. I just felt like, let God's will be done. And I just let it be. So I asked him, can I go see my parents? And at the time, I was thinking that way because I was like, I just don't know what's going to happen to me. Let me go back home, reset. He's like, how long would you be there? I was like, a month. He's like, actually 6 weeks. That was the longest I've ever been in Cameroon. And he was like, sure, go ahead and come back. So when he also said that, I was like, okay, maybe this is not even aggressive because, he was like, just come back and then we'll start everything.
Nina, I just wanted you to jump in here, right? So Anna, correct me if I'm not summarizing this correctly, but he said we'll do a leap, right? Which is where they basically excise part of your cervix, right?
Mhm.
Under the best case scenario, it grows back and they've removed the cancerous, portion, right? Did they do a biopsy with that excision that they got from the leap?
So that leap, yes. So that leap procedure is a bigger chunk that can show. So that's what they use in the lab for them to actually determine that, okay, well, this is not precancerous. This is actually.
Okay. So Nina, can you just comment on the options that he gave her for treatment, right? Like obviously leap would be if it was like below a certain stage, and then I cannot pronounce the other one you said, and then he said hysterectomy. There were two options he gave you. Yeah.
Radical trachelectomy.
Absolutely. So without being an oncologist, I should start by giving that disclaimer out there. I'm not an oncologist or a gynonc. But general rule of thumb, so after your cervical cytology test is done, depending on what kind of cells are seen, if they're precancerous or cancerous, then the management changes. There's such a thing as a colposcopy where they can just go in and sweep more cells in a smaller cone area, just at the very whole of the cervix. The LEAP procedure involves excising a larger portion around the cervix, getting a bigger chunk, it's deeper, kind of like a cone, to really cut through the transformation zone of the cervix. Because the cervix is kind of like the mouth. Like our outer lip has different cells. It looks like a different cell type from the inner mouth. So they try to get that whole transition zone so they can see where it starts and where it ends, basically. Now, cervical cancer is managed depending on how advanced that it is. So it has to be, like Anna said, it has to be staged. And there's 4 stages, and each stage has a different treatment plan. Stage 1, usually it's only around the womb itself, like the cervix, just that little neck part of the womb. Stage 2, it's gone beyond that cervix area. Stage 3 is when it's towards the vaginal canal into the pelvis, so the remaining parts outside the cervix. Stage 4 is if you have it in the bladder, rectum, like just in other areas distant from the cervix. Treatment plans, again, involve surgery, so a combination of removal of the bad cells or abnormal cells, and or chemotherapy and radiation therapy. So depending on each person's individual case, they may be subjected to receiving local radiation therapy, where they use radio waves or radiotherapy waves to basically literally like kill the cells down in that area. Chemotherapy obviously is the more systemic, so it goes throughout the body, again, to wipe out the cancer cells in the person's body. So it all really boils down to how the person is staged. And I find this to be one of the cancers where the process, when you're studying about it, even in school, it's like a tree, depending on because there's so many different kinds of abnormal pap smears people can have. There's a whole category of abnormal pap smears that are not cancerous. You have low grade, intermediate grade, high grade. You have atypical squamous cells of undetermined significance, which means we don't even know if that will become cancer, but it's an atypical formation. So all those typically can carry management plans that just involve a leap, just involve removing the cells and nothing else, all the way to your past, an atypical grade, a low grade, a moderate to a high grade, to a cancerous grade. And that's where you're talking, surgical options, chemo, radiation. So
And
like
that
Anna mentioned, yeah, go ahead.
that atopic part, that was it. That was written on my first, during my pap smear, the one that why he kept on saying precancerous, because it was the
Yeah.
one that was more like the atopic squamous.
Yeah, so atypical squamous cells of undetermined significance, called ASCUS, ASCUS. It's a more common variation that we find that pathologists would read for us on pap smears when it's not normal. So if you swipe that transition area of the cervix and you see normal cells, you say normal. Sometimes you swipe the transition area, maybe the sample is not well done at the time. Maybe the person didn't get a good brush, like they didn't really get a good brushing of the cells. Or maybe there are some cells that have atypical formation, but they're not cancer, but they're not normal. And so they'll call them that atypical grade. And a lot of people fall in that category. They still have minor procedures like a colposcopy or a leap or something in that category, depending on what else is in their picture. You guys asked about the trilectomy as well.
Yeah.
Is that one thing? Yeah. So that is a fertility preserving option. I wish I had a little like doll of a maybe I'm going to say this because it's not very obvious. Many people don't really realize how the uterus and the cervix relate with one another. Okay, so I'm not saying this because any of us on here don't know that, but I think it was not in high school, it was probably in med school that I learned the real anatomy of the female parts. So the uterus is by itself, and the very base of it, kind of like this, on my wrist, is my cervix, and my uterus is kind of like my womb over here. And you can work on the cervix. So you can cut around here and still preserve the sac, which is my uterus. So that's an option to say, I'm going to preserve you to carry, but you don't have a cervix down here. It'll still result in a higher risk pregnancy, like Anna mentioned, because there's risk of incompetence, because what if it doesn't hold the weight? What if it ruptures? What if, you're not going to be able to have a vaginal delivery? It'll be like always a surgical option. They may have to deliver early and things like that. And so it's an option to preserve fertility for women who are desiring fertility. Now, again, depending on the staging, if it's further advanced, then you have to also speak with that person about, well, what is the risk of recurrence if you took that option and preserved that uterine sac after removing the wrist, right? So you're kind of removing the cervix, but keeping the sac here. What if you have cancer cells which would be, beyond the stage 2, like that's further in. So what is recurrence risk? It's a case by case. It's a difficult decision. You and your oncologist, again, I'm not one of those, but you and your oncologist will sit down and have to really discuss these options. Your gynecology oncologist, because it's not every oncologist as well, but to discuss what your unique scenario presents.
So Anna, you've had this conversation, right, with the 80-year-old doctor. His age is not significant. It just stuck in my mind. But you've had this guy has given you your options, and he says, yeah, go to Cameroon for 6 weeks, come back, and we'll continue. Did you discuss a plan with him before leaving, or was it kind of, I'll come back and then we'll talk about next steps?
It truly was, I'll come back. This guy was asking me things like about Cameroon. Oh, I've never been there. Like, I liked him because I was like, Jesus, an interesting guy. But no, we didn't discuss it. He told me when I come. Like, it's almost like he already knew I was going to come back. Like, the feeling I got was just like, oh yeah, she'll be back. And then I think also with him behaving that way made me feel a little at ease.
Mm-hmm.
Like, I saw a little sadness in the first nurse's face, but when it came to the gyne oncologist, it was more like, I've done this for so many years. I got you, kind of thing. That was the feeling I got without him really saying it. And like with him, and I told him I want to preserve my fertility. And so When I came back from Cameroon, it was go mode. At the time, still, it was my sisters that were involved in this, and they were like, yeah, just go. So I was doing, man, it's the most interesting steps till you get your MRI. I don't know, so many blood work. Like my blood work was I probably went to the hospital every week, like twice a week for blood work, leading up to then the MRI. I think that was what I got first, MRI, because that's what's going to determine my stage. So they did the MRI, and then it came out stage 2B. So there's stage 1A, there's stage 1B, there's stage 2A, stage 2B. And obviously when Dr. Span told me about it, he's like, I didn't see this. I didn't know that it was stage 2B. I don't know if your cervix is hidden. He was saying things like that. And I'm like freaking out at the time. And he's like, so we're just going to scratch off what I told you. We cannot do a hysterectomy. We cannot do a trachelectomy and I was like, what do you mean? I need that. Like, what are you talking about? And he's like, no, we're going straight into chemo and radiation. So I'm sitting here like, oh, that's that feeling that was like, what the heck? I'm about to do chemo and radiation. What? That was not even like. So, and at the time, I'm sitting here, guys, I don't really know. I feel like I honestly felt like a superhero. I will not lie. I'm not trying to blow my bubble and on my horn, but I felt like a superhero because at the time I really had a lot of pep talks with myself. And it was just more of like, Anna, it's either you're going to just let the stress get to you or you're going to fight. Like I didn't have any other option. That's all that was coming in my mind. And at the time my mom was not well as well. So we informed my dad at the time when I got staged. My dad, we had to keep it away from my mom because my mom had to come here for treatments as well. So at the time, it was just more like, I also have to be strong for my mom. I need her to see that my faith in God is so strong that I'm going to get over this and it's going to make her feel better. That's all I kept on thinking about the whole time. So this was in February in 2022. And after that, my doctor said, and like I said, this God throughout the journey is because I've seen other people that have cancer that they're not even able to get appointments immediately. They're not able to get. I literally sat there with Dr. Span. He calls the doctor in Emory and says, hey, I have a patient that wants to preserve fertility. And the doctor said, let her come in tomorrow. I'm sitting here like that. And Emory is like backed up to get in there. It's backed up. So I'm sitting here, I'm like, but Dr. Span, I don't have money for this. He's like, just go. So I'm going there. I don't have money to be saving my eggs. That's what he said, if you want to have your child, go there. So I go there and I meet the doctor. And funny enough, the nurse was Cameroonian. And I think she was just more struck because we're the same age. And she's like, wow. So she comes in there and she says, like, I don't know if I'll even be able to afford this. You guys can do all the tests, but I don't know if I'll be able to afford this. And she's like, you will, because we have a whole bunch of grants. And she's like, for patients that lose their fertility or are going to lose their fertility with cancer, there's a lot of things that cover you. A lot of people don't know that, but I'm telling you, my Cameroonian sister. And she gives it to me. She's like, please fill this out. And, so I'm like taking my test. They do the whole, for you to get your eggs, they obviously have to do the whole, how do they call that thing when it's like you're pregnant, they're looking at your ovaries.
Ultrasound.
Ultrasound. So they did that first. They took my blood work, a whole bunch of it. I signed up for all those grants. It was about 5 grants, and I was approved for them. And I only had to pay out of my insurance $3,000, which it's a lot, but it's not a lot compared to what each vial of the injections I was giving myself cost. I think each vial is about $1,000, and adding up to it, because take it back. I had 2 weeks to prep for when chemo started from when I got told about this. So I had 14 days to do where I was doing the whole process of IVF to preserve my eggs. And then I had immediately after that, I had to get my port. A port, Dr. Nina is probably going to explain that better for me. And then my port surgery was on a Saturday and I started chemo on a Monday. So that's how short my time frame was. This was all in March. So I'm like, okay, I want to preserve my eggs as much as I can. So I get this opportunity for grants. They pay for all my medications. I start taking it. I'm lucky that my doc, everything went well. I was in the hospital every 2 days for 2 weeks. So after during work, I'll just go out to the hospital and come back. To be honest, I mean, not even talking about it, it takes a toll on you, but to me, I think I was on go mode the whole time. I didn't really stop to feel my feels. And I like that I was that way to a fault. Like I was on go mode. I wasn't like, Anna, you don't have time for any of this. You need to like, how did they say you're precancerous? You might be precancerous in November and then they're staging you at 2B. You don't have time for this. So when I got my IVF done and I was able to preserve my eggs, thank God, I ended up preserving it. And then I went straight into surgery like a couple of days later to get my port placed. And then I started chemo March 28th, I believe, of that year. So it was just bam, 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 bam. My body was going through all kinds of things, not even healing, but I just didn't have a choice. To me, it was just like, I don't have a choice. This is my life. This is my health. And I want to get well. So
It's amazing.
yeah.
You mentioned that your sisters, they were kind of with you on that journey from the beginning of all of these, first getting the abnormal and then finding out it could be. So were they your primary? So obviously you told your mom at some point, but not initially, right? Because like you said, she was in poor health. So
Yeah.
can you just describe how your sisters and any other person who supported you, what are some things that they did that were helpful or encouraging to you, particularly prior to you kind of finding out exactly what your stage was, and in this period of, well, I'm kind of waiting to know more?
I think so. At the time, I did tell my closest friends as well at the time in January time. My sisters, anybody that knows my older sister will know she's extremely hands-on. She's very like, she's on her stuff. So I just really could lean on her to do research and to kind of like guide me, even though she's not a doctor, but to guide me, because to be honest, I was thinking going the holistic route, which even till today, I sometimes I'm like, I wish I did, but I didn't know as much. I was doing my research, and I think that was the one time I did see some type of fear in like, I don't think you should do that in her, because I'm sure she had done her research where it's like in America, it's not something that's very common or it's not FDA approved, but I'd rather you go this way because it can be cleared out immediately this way. So it was just more of like helping me do research, not letting me worry about it. And prior to it, that gray area was just more of like, don't think too far. Let's just take everything a day at a time. Being on call with me when I'm doing my injections for IVF. And at the time, I think everybody was just on wait mode to see what they can pick up when now everything is given to me. Like everybody was just kind of like on pause, not trying to freak me out. So my dad, on the other hand, too, that's probably a moment in my life that I'd seen something I'd never seen in him, because he had to be the rock at the time because his wife is not well, his daughter is not well. And it's just like, the way he handled it, it's just, yeah, I commend, I commend them. I don't know that I would handle news with someone that I love the way like my friends, my family handled it with me. They just preserved me from really the stress of anything during that time. And I'm talking about the time prior to me starting, because prior to me starting, like after starting, it was a different ball game in a great way, obviously. But yeah.
So Nina, can you just go over some numbers with us? What are the numbers in the US for women who are diagnosed with cancer each year? Cervical cancer, what's the survival rate as well?
I had to do notes on this part because I thought, wow, some of the numbers are pretty intense when you think about it, especially for minority women. First of all, like about 84% of cervical cancer cases in the US or worldwide actually are from women in resource limited areas. And so whether that means that resource limited in the sense of like access to care, screening opportunities and things like that. Cervical cancer by itself is the third most common gynecological cancer in the US. So it falls under uterine and ovarian. However, for Africa, which is where we're all from, cervical cancer is the leading cause of cervical cancer-related deaths in females. So here is the third in the gynecological category, but there's a lower risk of death from cervical cancer here in the US, obviously, compared to where in Africa, it's the leading cause of death for women. So the incidence of cervical cancer is on the rise in the continent of Africa. So I think if there's a place for any of our listeners who have ability to advocate, this is one area where, you know how we do all the sensitization campaigns in Cameroon? We need to also push that message of pap smears routinely for our women. In the USA, there's about 13,820 new cases of cervical cancer diagnosed per year, and a smaller fraction of deaths per year, which is about 4,360. I believe that again is because of that latency period, which is that 10 to 15 year period between exposure to actual cancer showing itself. And then here, because we have these screening programs that are in place for women to have pap smears fairly routinely, 3 years, 5 years, we're able to capture cases in that atypical squamous cell or those lower grade precancerous lesions a lot quicker. Now, here's the kicker. In the United States, Black women die at a disproportionate rate compared to white women who are diagnosed with cervical cancer. So 10 out of 100,000 for Black women will, I hate to use the word will, but about 10 will have been proven to die per 100,000 compared to 4.5 for white women. And this disproportionate mortality rate is also similar with Hispanic populations. So Black and Hispanic women, when diagnosed with cervical cancer, are likely to experience death more than their white counterparts. So again, the age of diagnosis here is a little bit further from Anna's age, right? Like it's closer to 50, right? The age of diagnosis. So, and even in my limited practice, I don't do a lot of current outpatient care where I do routine screening, but in the hospital where I've diagnosed women with cervical cancer, it's usually on a case of abdominal pain or a case of back pain that came to the ER and I was looking for something else and saw it, kind of thing. And even at that time, I don't know what it is. I just know that there is an abnormal appearing lesion or something around the cervix. And in most of these women, they're women who have not, in all the cases I've seen, they would tell me I haven't had a smear in years. So they don't remember the last time they've been to a doctor. They don't remember the last time they've had anybody. The last woman I saw with this she told me the last time I've been to a doctor was when I had my kid. And that was 20 something years ago. And it was a C-section kid. Yeah. And she was like, I've never been to a doctor ever since. And obviously she was much more advanced at that point when we saw her. And again, this lady was also in her 70s. So I'm not saying that it's not typical that for us, the median age in the US that we diagnose is a little bit further into the 50s. But it can happen to anyone at any age. And I'm so actually very, very inspired by Anna's story today because one, your courage, I can see your courage through even how you share your story. And that is something that I commend you for. And even coming up front and talking about this in public and letting people learn from your story and being open and willing to share something that could be extremely traumatizing. I just commend you for it. I think God be with you. Like you said, as he's been with you on your journey, just let him continue to be with you because you're definitely a blessing in many ways, especially to me tonight.
Thank you. And I thank you, Nina, for saying that. It's interesting because I've never been ashamed or like scared to share my story, but a lot of times, and I think, and I've probably spoken to you about this, maybe just during a conversation, but I just never know the right words or really to explain everything. And then even with the African community, I didn't know anything about this. Like I did not know. This is one thing. I did not know the correlation between possibility of your fertility getting affected from any type of cancer.
Mm.
I didn't know. That's probably extremely ignorant, but a lot of people don't also know that. That was actually the most shocking parts to me. And I'm like, how do we go from 0, like I said, to 100? Like
Yeah.
what is all this? And I think in our community, because even when the people that I told at the time, or when I was about to start, my close friends, a lot of them would share with me like, I haven't had my pap smear. Oh my God, let me go and do it. It's like Dr. Nina said, it's extremely common where you have women that have not had it because you don't really feel anything. You like, so in some cases, you don't feel like, okay, well, I've been safe, I've been this. So there's not that you're saying there's no need, but like, it's just, you don't really think about it. You don't think
Mm-hmm.
that it's going to get you here, right? So,
Yeah. And it's such a preventable cancer, right? Like, because if you find it early, you can act on it quickly, and person will do really well thereafter. But I just wanted to comment on the fertility preservation part because I feel like you're right. It's not spoken about, not even only for people who actually need it, like for patients that are exposed to chemotherapeutic agents or people that are exposed to chemotherapy agents, but even just for the general public. I wish it was more talked about, just even for healthy individuals, right? But particularly when a person is going to be exposed to chemo, we have to always think about how chemo works. It literally kills cells. And the goal is to target the abnormal cells. Most cases, all cases, chemo is systemic. You
yeah,
have to take it in your mouth or you take it in the port, which is a small reservoir that they put under the skin to be able to deliver medications frequently because the person's getting infusions frequently. The infusion doesn't spare a body part. It doesn't say, oh, I'm just only going to go and help the cervix out, but it can affect other things, including the cells that are in your ovaries. When we're born as women, all our eggs that we have are in our ovaries at the time of our birth. So it's not going to now hide itself because we're going through chemo. So if we're going to expose those reservoir of eggs to chemo, then it only makes sense that we can go in and try to quickly ripen some eggs, remove them, and save them so that we can, if we are exposed to chemotherapy and the chemo affects our egg reservoir or affects the quality, because you may still have, it doesn't mean you're not going to make eggs. You still make eggs, but we don't know what those eggs, what their quality would be. So you may still fall pregnant, right? If you still have a uterus and you still have your ovaries, but is it going to be a healthy pregnancy? Is it going to be a normal pregnancy? Like
right.
those kind of things. So if you want to preserve the best eggs, which is the youngest eggs everybody can ever have, you want to go for it before that body has been exposed to any chemicals, any outside substances like chemotherapy. Save those so that the person can go through treatment and then be able to use their healthier eggs that have not been exposed to toxins later on.
It's not a funny story, but it's a funny story of my first chemo. I come in there and I'm sitting down, like you said, they put whatever the IV into your port, the infusion. And I see the pharmacist come in with like all geared up gloves and stuff. She's holding the infusion. And then my chemo nurse comes in and she puts on her coat thing. She puts on her this thing. She's gearing up. So I'm like, wait, why are you guys gearing up? So in my mind, I'm like, okay, they're
You're
probably
gonna
going
put
to.
that in me.
And then she goes, no, it's bad for me. It's good for you. These people are killing me. And like Dr. Nina said, it's like, I didn't know what that was, but it doesn't only attack your bad cells, it attacks your good cells. And that's what makes your immune system, it takes up all your energy, it sucks out all your energy. And I mean, chemo is the worst thing that I would never even wish that on my worst enemy. But yeah, that was like when they geared up, I'm like, what is this people doing? Like, what is this?
So I was on the CDC website and looking at some of like their data visualization, and they said the last data on there is from 2021. But something I noticed on there is there's a difference. It seemed like there was a difference in like incidence of cervical cancer based on location. There's like a large chunk in the south from like Texas all the way to about Georgia and Florida
Hmm.
where it's 9.2 to about 10.5 out of every 100,000 women. Whereas in like the Pacific Northwest and middle prairie states, the incidence is more around 3.8 to 5.8. So are there like do you know of any geographic factors or what any correlation between those areas and where it's higher in some places and lower in others?
People are ratchet in Georgia and Texas.
Hey.
I don't know. To answer your question, Bill's like, I don't know of any research proven data to explain the discrepancy. However, I may want to think of the population. So is there a larger migrant population in the southern states is one thing that I ask myself, because the incidence of cervical cancer is also higher in Southern America, like South America and Central America, than it is in North America. So is there a little bit of that population up towards the south compared to the northwest and midwest? That's just something I would think, because if the incidence is also high in Hispanic and blacks, are they more in that geographic region? That's just something that I would think, but I don't know the answer to say what has been proven, like what the association is. The other question too is what ages that they're testing, how rigorous their testing programs are in these states. Like there's some states that may have more, free for all services when it comes to health screenings, that have more initiatives in place to help people who are of a lower socioeconomic status or have other like risk factors. Because you got to think about it, like what are the risk factors of cervical cancer? Usually socioeconomics play a big role, because it's really about who's going to get screened when and how early. Early age at first birth, so you had your child at a younger age. So are you seeing that more in a certain demographic that's located in a certain geographic region? History of STIs, multiple sexual partners, even having one sexual partner but who has high risk behavior. So if the other person has high risk behavior, immunosuppression. So does the person have like other conditions, HIV, hepatitis, things like that? Contraceptive use is a risk factor. IUD, presence of an IUD, smoking, genetics is a risk factor. So if those things are existing more in one geographic region or one demographic, and they're located in a certain area, maybe that has a relationship, but I don't know the evidence-based answer.
Okay. All right.
So, Anna, obviously you had this conversation about how treatment would impact your fertility, right, prior to going in, and you took these steps, and that's so amazing how you were able to get the grants to do the egg retrieval. What were some other side effects of the chemotherapy, and did you feel like you were given enough information going into it by your medical team, like you knew what to expect in terms of side effects and how your body would react?
Yeah, absolutely. And I love that question because so you see two doctors when you're going through. So my treatment was chemo and then they had the radiation. So the first thing that they did after my port, they gave me a calendar of how my treatment will go. So I had 5 days of radiation and 1 day of chemo every week. At the time my treatment was an 8 weeks plan, which is 2 months, and then basically 10 weeks, and then 2 more weeks for brachytherapy, which is a form of radiation that they inserted into your cervix directly on. So that one outcome. So of course, when all of this happens, Google is your friend. So I start researching Google, and for all we know, all of us know, even if you put, I have some kind of rash.
You are dying. You are dying.
All right. So like, I remember this very vividly. After I was done my oncology, my gyne oncologist, he's the one and his nurse that take care of the chemo side. I was sent to my radiologist, and that was my favorite doctor ever, Dr. Pollard, another Black male. He was probably in his early 40s. Amazing with his staff, and it's same in Piedmont. His staff was amazing. And he was so thorough with his explanation. So he now handles the radiation part and he explains to you. And at the time, I had a friend in the past that we were very close. And I noticed that he worked for Emory and he worked in radiation as well. And, something just prompted me like, okay, let me hit up, I'm going to call his name, but B-Song. I'm like, let me hit him up. And as soon as I hit him up and tell him what's going on, he's like, I'm coming to your appointment. And I was like, okay. So this is someone I've not spoken to in a long time. And that's why I said this is where I see like a lot of God appearing, because I didn't really have any hesitation or any no's or any like bumps along the way. So I go to the appointment with Dr. Pollard and he explains whatever he's explaining. All of those radiation things don't make sense to me, but he's explaining the best he can. He's explaining what I may experience and all that good stuff. And Yusong is there and he's like, he tells me, this is a good doctor. I'm comfortable, you know. And so one thing that they called out was, I'm going to be nauseous a lot. I'm going to be very weak because that's what the chemo is going to do, and the radiation equally both. I'm going to possibly have rashes, like very dry skin. So the radiation is directed obviously below, not above, you know, like if you have breast cancer or thyroid or something, but you're below. So he's like, you probably get very dry skin there and stuff. He also, I stopped, I said, can I cut my hair today? And he goes, you don't need to cut your hair. And he laughed at me because he was like, why would you cut your hair? I'm like, because it's cancer. I cut my hair. And he's like, well, we're not targeting your upper body. We're targeting below. You would experience the hair loss below, not on the top, based on the treatments we're giving you. Now, if you go longer, you may, obviously with your weakened immune system, you may experience that. But from my knowledge and from what I've experienced in the past, you wouldn't. And what else was that? They said I'll experience like a bad taste in my mouth, like food would become really hard for me and things like that. I will also, he says, you may gain weight versus lose weight because of the type of chemo that is being, you know, you have a lot of water retention, your kidney, just make sure you're hydrating yourself. That was one thing he was like, and he's told me there again, no Google. Please, no Google. And I think it's from when Dr. Paulette told me that, I just stopped. And I even had to tell my friends, please don't do Google. I had a really close friend that took care of me during that time, that I know she used Google to help me, but she was always like, Google said, you know, but like, you know, so, and I want to highlight this part because maybe you will not ask, did I experience any of those things? No. I didn't have any dry skin. I didn't get any rashes. I did lose my hair down there. It's better for me anyways. Did I have headaches? Yes. But was I nauseous? Barely. I still have my nausea medication. Obviously, I'm not going to use it. It's expired, but I still have the full thing. And Dr. Paula will always say, Miss Foncha, why aren't you using this? Why aren't you using your pain medication? Because I also was given, and I'll tell him, well, Dr. Paula, I don't think I'm experiencing pain. I'm just weak and I just feel sick. And he's like, what do you mean you're not experiencing pain? I'm like, I kid you not, I'm not experiencing pain. We used to have those conversations every day when I come in there, because he like, are you taking your pain medications? I'm like, I don't like pills and I'm not going to take it. Even my other friend who's an oncology nurse, she would tell me, Anna, why aren't you taking it? I'm like, I don't feel nauseous. Why should I take it? So I'm just saying this to say, a lot of times we see Google will tell us these things, you know, that this is what people experience generally, but I didn't. I'm not saying mine was easy, but I didn't. I threw up once over the span of my treatments. I've spoken to people that had cervical cancer that threw up every day. I spoke to this African-American lady that's a little older than me, and she was like, what? I threw up every day, and I didn't. My experience was not seamless, was not easy, but honestly, God was just literally by my bedside the whole time and just making sure that I was going through it like really seamlessly. So yeah,
Awesome.
that's what.
So, I mean, I'm going to throw it back to you, but one takeaway that I've got from what you're saying is like, if you are supporting somebody who is going through treatment, it may not necessarily be chemotherapy, but some, you know, like very scary treatment. Don't start Googling shit and come and tell them, I saw this on Google, I saw that, right? But what are some other ways? What would you share? Some things that your sisters, your friends, your other support system did for you that was particularly helpful during that treatment period? And
I want to also highlight my friends and family came through. Like every time I always get a little emotional, but because when I got the calendar, when I shared the calendar to my closest friends in Atlanta, because at the time my mom wasn't well, so my dad and my older sister were flying back and forth between Atlanta and here, and also my immune system wasn't the best for me to be around people, so I was alone a lot of times. But my friends literally created a group, the ones in Atlanta, and created a schedule to take me to treatment every day. You know, and that's funny enough, that's one thing that like my doctor and the staff would always say they even knew my friends because it was the same people that came all the time. They took me to radiation every morning, and my radiation was at 8 a.m. And on chemo days, after radiation, I go upstairs to chemo that starts at 12 and finishes at 4. So you have my friends staying in there, and anybody will tell you in the chemo room is freezing. And this was around March and April. So just the sacrifice that they did, calling me, what do you want to eat? Cooking for me all the time, dropping off food, like being self aware that, oh, I was around people, so I don't want to come to Anna to potentially make her sick, but still being there for me, being on the phone with me. I just don't even know how to say it, but like your support system when you have cancer does everything for your mental health. And when I found out in that February time, I actually did one thing that I am grateful I did. I looked on Instagram and I started looking for cancer survivors that had my cancer. And I found 3 ladies that were, funny enough, one was African American, she still talks to me, and 2 were white females. And they actually answered my DM. They had the same diagnosis like I did, but the 2 white females actually had were done with their treatments, but they had a lot of complications. So, but they were so encouraging for me, while meanwhile, which is interesting. And this is one thing that, will probably be even shocked, even with the statistics, the African American lady, she was fine. I think the one thing she experienced after was just kind of like weakness in her leg or something. But instead, the other ladies were, had things, but they were so supportive. And then I found a Cameroonian lady, which a lot of you probably know, Angel. She gave me her number, and because I found her online, I don't know her. And she's like, I didn't have your cancer, but call me. And there's a couple of things she said that were very key to me saving my sanity. She says, in Cameroon, they always want you to feel like when you're sick, make like that, act like that. Please keep the normalcy in your life. If you're working, work. If you're working out, go and work out. If you want to watch your movie, don't act or feel sick. People are going to ask you that, Anna, don't you have cancer? Why are you going grocery shopping? Anna, don't you have cancer? Why are you? She was like, make sure keep away all your stressors. And as soon as I told my older sister that, that's one thing she did. Not that I didn't want to tell people, but I noticed that when people came to me and like, where Anna, the whole sorry thing, it didn't bother me. It made me feel bad. It made my mental health sink. So one thing my older sister did was she would tell people how I was doing. They would check on me through her. And she always would tell me, oh, even Nina sent me some chocolates. I remember that. Like she would tell me, I told this person, so you're fine. I've told them, because I also I felt bad that I didn't want people to feel like I didn't want to talk to them. But a lot of times I was so tired. I was always just on my couch and I was working. Even my team at work, oh my God, shout out to my job. Like they would tell me, go rest. Anna, are you good? Go rest, and stuff like that. We got you. And just, she would do things like that. She would text people and say, yeah, Anna is doing well. Yes, you can text her, or no, let's not text her now. I'll update you. So that shielding was so powerful to me, because I didn't get a lot of, hey, Anna, this. And I'll not also forget Nina's brother. He's a very good friend of mine. And he came and saw me during my treatments. And I remember he was hesitant. He was like, he came because he had something happening in Atlanta. And he told me this. And I think that really broke my heart. He said, I didn't want to physically see you because I didn't know how I was going to react. I didn't know if I was going to break down. I didn't know how you looked. But I'm so happy to see you. I'm so happy that you look like you've not been through anything. Like it made him happy. And I got a lot of reactions like that. My friends really shielded me. Like I said, they didn't come to me like, oh, Anna, where? They just came, what do you want? We're going to get cleaners to come to your house every week. We're going to cook for you. Just tell me what you want to eat. We're going to eat. It was just, I didn't lift a finger. And I would say, of course, the no Google, I would say like having people shield you, no stress. I would really spend my time working and then go watch my favorite movies. I watched probably all the seasons of everything I loved when I was going to chemo because it just made me happy. I actually got a lot of time to be by myself and even get to know myself better. By being alone, that was probably the most powerful point in my life because I also connected with God. There were just so many signs. If you ever believe in a higher power or God, it was so clear. I heard him a lot of times. And it's not like, oh, I heard him talking, but in just the way he sent people, I would have some Uber drivers when I'm going to chemo. Sometimes if my friends are not able to get me, that will randomly tell me, let me pray for you. I don't let people pray over me, but I got a lot of that even without them knowing. And I just knew that that was God talking to me, telling me I'll be okay. So it's we have to undo our mindset, our African mindset, because even when my mom was not well at the time, her seeing me the way I was seeing me, she'll always tell her friends, this is my baby. I don't know how she was doing it. She'll always say it. She's like, she's the one that will call me and tell me, Mama, everything will be fine, when she's the one going through cancer. Like, everything was just full circle to me. To me, it was just, I told God already in the start that I just want to be a better person, to be better, look better, feel better, and in every aspect of my life when I came out. And I think during that battle that the devil tried to do whatever he was doing in my life, and I won the battle, just like the blessings and blessings were just coming. Because even you also asked me about like the brachytherapy. If you ever research brachytherapy, you will probably close your eyes, right? That part of brachytherapy, I laid on my back for 48 hours it's so uncomfortable on that hospital bed. And I did that twice because of the way it's inserted. And Dr. Nina will probably explain that better. But during that time, in my last brachytherapy session, I literally was like, I still have the video. I was like, I'm done. I was like, whoo. During when I was in the hospital, the nurses will come into my room because they give you a pain pump because you are supposed to experience, Miss Foncha, why aren't you pressing your pain pump? And I'm like, Jesus, you guys don't understand this. I'm not feeling any pain. It's like if I'm feeling it, I'll press it. And I remember the radiology tech is an older guy. He said, in 25 years in my life, especially people your age, I've never experienced anyone that hasn't cried during this session. And I told him, I said, trust me, I'm a crier. If I have to cry, I will cry. But I literally did not feel any pain. But he was like so happy. He was like, that is so strange, because if you look at what they do in the brachytherapy, it's a whole surgery. I mean, they put you to sleep and they do whatever they're doing. I don't even understand how I wasn't feeling pain throughout. I think that's really my main thing. Like what I went through, I'm very shocked at the minimal pain I was experiencing. I felt sick, very, very sick. I felt like my soul was over my body a lot of times, but did I feel pain? Barely.
I'm just curious, by pain, you mean like physical pain, but you had like more emotional pain, or
So when I say
you
pain, like meaning like your cervix will probably
hurt?
hurt, or certain
Okay.
things like after radiation, you're experiencing dry skin, just those side effects that they're expecting. Maybe pain in my cervix, or yeah, just I guess general pain even from the chemo. First of all, during chemo also, like I don't know if it's everybody's chemo, but the first 2 hours is they're hydrating you so your kidney doesn't get affected. So it's saying they're just hydrating you. So you pee a lot, like as much as you're weak, but you have to pee a lot. Then the next hour before they bring the chemo and put it in, they give me Benadryl every single time. So a lot of times I was super drowsy. I slept throughout chemo. But they said, because I forgot the chemo that I got, but because of the chemo, they're like, it's too hard on your kidney, it's too hard on you. So they used to give me Benadryl all the time. And yeah, so that's what I meant by pain.
So your total treatment time, was it 10 weeks? You said?
10 weeks, yeah.
Okay. At what point, do you find out, like, has it been effective? What can you just talk us through? You're done with the 10 weeks, then what happens?
Child, this is the part where I did not know either. Because I'm like, we're done, we're ringing the bell. Okay, that's one thing too that I rang the bell twice. You ring the bell when you're done with radiation, and you ring the bell when you're done with chemo. And I just thought that, okay, that means you're cancer free. That's what I always thought. I didn't know that it meant we're done with treatment. I thought that means you're cancer free. And that's why I feel like they may need to change that a little bit. The reason I'm saying this is because in the chemo space, where I was sitting, it's not like there are rooms. Everybody's just sitting down having their chemo, so you can see the person across from you. The bell is inside there where I'm ringing the bell. I get it that it may make people feel a little happier that, oh, my time might come. But I almost felt so awkward ringing the bell, even though I was super drowsy when I was ringing it, because I'm like, poor people, some of these people have been here for years, then they're seeing me ring it. It's like, wouldn't that make you feel bad? Like I'm still here. And then I think that the culture is great, but maybe they should take you into a room with the nurses, and then the nurses can clap for you versus doing it there. But that's just me, how I felt. I'm an empath. So I just felt really bad for the other people that were there and didn't get to ring the bell. So I get done and they say, in 3 months, we're going to do another scan, a PET scan or a CT scan. 3 months. That's when they need the medicine, the chemo and everything to work. It's doing its work. So I'm sitting here like, and you guys will not probably, if you watch my Instagram, that 3 months, went for my friend's wedding, 2 of them. My really close friend, I was her maid of honor. I actually got a gift from my beautiful friend and her husband. They bought my ticket to Barcelona. I didn't still know that I was cancer free there. I was still waiting. But in my mind, I was like, bruh, let me live my life. That was honestly what I thought. I was like, and that's my motto. Like, you cannot, our Africanness would say, oh, let's be sad, dwell in your misery. I'm not one to do that. I am not dwelling in my misery. I'm not going to be sad. If you want to be sad on your own, but I'm not going to be sad. And I tell my parents that all the time. It's just, to me, you never know when your last day is. I went to Barcelona because a friend gifted me. He told me, like, him and his wife were like, I want you to go with my wife to Barcelona and have a good time. And then I had booked my flight to Cabo, but that was a tricky flight. That was a tricky trip because it was my friend's birthday. But also I told her, if I don't get good results, because literally I was supposed to know the day before I flew, I'm not going to go with you. But if you see me going with you, then you know what's up. And 3 months later, I got a call from Dr. Pollard. I actually missed his call. So I had a voicemail, which scared me. PTSD. I'm looking at it like, hey, God. And I'm like, so I listened to it. It's like, Miss Foncha, call me now. Call me now. And I'm like, hey, that sounds good. So when I called him and he told me he declared me cancer-free August 23rd, I should know this, August 23rd. August in 2022. So it's 3 months. And then you find out after your CT scan, and then you're in remission.
So you found out the day before that Cabo trip?
Yeah, and I went and turned up.
Listen, they would have wheelbarrowed me on the flight back.
So I'll not lie. You guys know my chart. I'm sure everybody knows that. I'll not lie. The results came out 2 days. So sometimes your results come out, you see it, but the doctor hasn't called you yet. So you're trying to put everything on Google to see what that means. Because I cannot tell. It wouldn't say your cat. So I got it. I saw it. I just prayed over it. And I said, I think this looks like I'm not. But I don't also want to say that saying all this squamous, this. I don't know what that means. And you cannot call them and ask. You have to wait for them to call you. So I'm looking at it. I'm like, I think I'm cancer free. But I don't know. I'm not telling you. So yeah, so they send it to you on my chart, then your doctor calls you and they give you your results. So
I mean, that was in August of 2022. We're now in October of 2024, right? Can you talk about, because when we initially had the conversation about you coming on the podcast, it was kind of off the back of our grief series in September, and you mentioned that you had gone through a grieving process, coming to terms with how the treatment impacted your fertility, right? So can you talk about what were some of the stages of that grief that you went through, and what is your perspective now, 2 years later?
Absolutely. I would say I watched a couple of the grief sessions. I need to go and follow up on all of the rest. And it's very interesting because there was a time when my friend that lost her dad made a comment to me that, and I never heard that from anyone, but it was in my recent years that when you lose someone, you never really heal. There's some good days, and then there's some days where it just feels like it just happened. And I did realize that from a lot of the guests that came on here, but I didn't really truly know what that is, because even though I have lost, one or two really close family members, but I just did not really know what she meant by that till this time. And with me is, I didn't really process it at the time it was happening, but I did process it a lot when I was going through my treatment. But also during that processing was just more of, because I was alone, I was able to, I guess, be very emotional about what actually was happening. But one thing that also popped up was, you have this, for me, I had very random thoughts being an African, like, who would want me? Like how, yeah, I wouldn't lie. I spoke a lot to my friends about that. Like, anybody that knows me knows I adore kids. And I mean, it's not like, oh, I adore children. And that was also at the brink where I really started thinking about it. So it was just more of like, how do I go out again and date? And honestly, that also prompted me, and I'm not citing note, but back to like going back to who and what I was most comfortable with, because I knew they already knew. I don't need to start all over and all that stuff. But it was just more of like randomly crying and randomly like, oh my God, what happens? Because you also have to think of, what if, God forbid, those eggs don't take? What are your other options? So I started thinking, am I okay? I started asking myself those questions. And I think that's what you face yourself during that period. It's like I was mirroring myself. I was asking, I talk a lot. I'm sure I've always said this. My neighbors probably think it's 5 people that live in this house. I'm not crazy, but it's just because I really talk out loud to myself.
That's funny.
You ask yourself those questions, and I ask myself, like, am I okay with that? Am I just saying, I've never thought of adopting because that's how I was raised. I was raised in a family of, 2 household family with my sisters. How do I feel about this? I started asking myself those hard questions. What, God forbid, what if I'm not able to adopt? What are my other options? Am I okay and comfortable with having like my niece and my nieces, my nephews? Am I okay with that? So I was asking myself those hard questions, because these are things that I never thought in my life that I had to, do, or I had to think about. So my process at that time was just a lot of crying. I just cried a lot, and I cried a lot by myself, but I also lashed on to God. Everything, I think, the wording that says let his will be done meant more to me, and is still meaning a lot to me than it's ever done. I think we just usually used to freely say that, let your will be done, but we really don't know what that means. Letting God's will be done can mean that if you don't have kids, then what? Is your life over? If you're having a surrogate and you have just 1 kid when you want 5 kids, are you content with that? So those were my first year. Those were the questions that were coming and reoccurring with me. And it almost, even I wasn't with who I was, even with dating, it always forced me to, I wasn't scared. I would just always bring that up immediately and just say, if you're not okay with that, just leave me. Because that was also me shielding myself. Like, I don't want to go through that. I don't need to hear that you want this when I cannot. So there are triggers that happen, but then you have to know how to react in those triggers. Like, honestly, for women that are going through it's just, I think we need to unlearn. And I think I've used this word a little earlier, unlearn those things that are engraved in us from our African upbringing, and be open, start opening yourself up to other things. Even if this doesn't happen, there are other options for you. So just what makes me happy and what makes me feel a little relieved is just during the grievement process before and now. Now I can speak about it and really encourage people without really breaking down, without getting offended. I also take my time, not knowing that that's not what makes me. That's not what makes you a woman, in a sense, right? It's just an unfortunate thing that happened to me. And I take my time, even with therapy. I never thought I would be the one in therapy, but therapy has helped me to, strange enough, and this is where God comes in again. My therapist, I did not know this, also lost her fertility in her 30s. She actually opened up to me later on and says, "You talk about this a lot, and I just wanted the right time to tell you, but I've gone through this." So it's so funny how that's the therapist I chose that had gone through what I, not through this way. She lost her fertility in another way, but, processing, answering yourself, asking yourself what you want, asking yourself what you'll be okay with. That, I think that's where I am. I really hold myself accountable. I let myself feel my feels. Sometimes I'll sit up, cry every day, but it's not the end of the world. I just tell myself I'm alive, I'm well. I have my nieces and nephews, my friends' kids that are my kids, that, I love, and let his will be done. I do look forward to the process. So by the grace of God, I can start soon. But I think that I'm almost there where I'm okay starting, because you also have to know when would I be ready to start it, because that opens up other wounds for you, so you need to just make sure that, like, I had to make sure that my mental was stable, how I felt about things was from me, not from what people are saying or what Google is saying. How do I really feel about these things?
Thank you so much, for sharing your story. You've definitely overcome, an incredible experience, and you're here to talk about it. So thank you so much for sharing that. So Nina, before we wrap up, you mentioned this earlier on, but I just want to, to reiterate for the listeners, right? The purpose of this episode is not to like scare anybody, right? Part of it is for awareness, right? So first and foremost, talk to your doctor, your gynecologist, about screening. But Nina, for people who have maybe limited resources, what are some ideas or places that they can turn to for free, screening? Let's say if they don't have health insurance, or, if financial concerns are there, where can they go first and foremost?
Yeah. So I always say closed mouths don't get fed. Okay, at least not in America. There's always someone somewhere that can help. You have just not asked enough people. That's my theory. We live in a resource abundant society. I don't care what anybody says. Now, that being said, easy places to start. And I want to also point this out for immigrants who are not permanent residents, who do not have health insurance, who are not even legally in the country. Okay, so legal or illegal immigrants. First and foremost, nobody is going to discriminate against you when you ask for care on the basis of your immigration status. I say this because I see so many people who only come to the ER at the last minute. It's been so bad. They've been avoiding care because I don't have insurance. I was wondering if I'll get found out. Several different barriers. So this is for everybody. That person, and even the person who has just limited resources. You have a job, but you're below a certain income level. It's for everyone. Look up the local health department in your area. The health department is the one place that you can show up to and knock on the door or call ahead of time and ask for whatever service you're needing. Whether that's like usually screening services, I should say. Now you can't get like a surgery scheduled through a health department, but they can at least guide you to the right places. But their health departments usually even have health personnel, and some of them will run these screening services for you. I have done this for my family members who are in the States for a visit or for other things, who have an emergency, or we just want to get certain screenings done through the local health department. So just look up the health department in your area. That's the first place to start. The CDC website also has several resources across the country that will help you get screening services, okay, for any major, diabetes, hypertension, all those kind of things. You can get so many free resources through the CDC website as well. There are other clinics, privately owned or most hospitals are non-profits. So a lot of them have embedded programs to assist the community. Now, some hospitals may restrict that to residents of that community. So you need to have some kind of residency, proof of residency in your area. But most hospitals, nonprofits, most Christian-based hospitals will always have a program with financial assistance that can help people who are underinsured, uninsured, undocumented, and whatever the case may be. If all else fails and you are at wit's end, show up at an emergency room. The emergency room is the one place that you never get turned away. You don't get asked for insurance paperwork. You will get seen. It's a right. Now, private practices in your area may vary. If they're for profit or privately owned, they may not always have those initiatives. But before you even get there, between your health department, between the local facilities in your area, so just look around you. What hospital is close to me? Can I call them and can I ask? Because if you don't ask, you will never know what exists. Now, that being said as well, there are other social groups that will offer complementary health services. And for most of us that are in certain cultural communities, speak with your cultural communities, because within that group, you'll have women, men that are part of other large organizations that have these sort of services in play. Clinics such as even Planned Parenthood as well, they are known for many other things, but they do also offer screening services, especially for gynecological conditions for women. You know, don't always think that even if you're not for whatever other things that they offer, you can still get certain benefit services like screening services for women conditions. I think between those, you'll get somewhere. If all else fails, you can also just use your Google search for your area to say, where can I get free screening in my community? There's obviously health fairs that happen at facilities, but we're in the day and age where AI can really help us or it can really hurt us. Just put it in. Put your zip code in there. Look up free health services in my area. Usually those pop up mostly in the summer and spring where it's nice weather. Some churches as well will have such screenings. Even the keywords free clinics in my area. There's several what we call FQHCs, so they're federally qualified healthcare centers across the nation that offer care to underinsured, uninsured members of the society and whatever the case may be. And if you don't have these problems and you have access to care, great. Then make sure you contact your physician if you haven't already had that, and just prompt your physician too. I think sometimes we put a lot of responsibility on our physician to remember everything. Yes, some physicians may have programs in place where they audit charts and say, hey, this person hasn't been back to the clinic in 3 years and they're due for their pap smear. Right now with my chart, some of those things are auto-populated. So you get a reminder with AI to tell you, hey, you're due for your pap smear, you're due for your breast exam, you're due for this and the other thing, you're due for this vaccine. But let's say you don't have that yet. Prompt your physician. Hey, I'm 35 years old or I'm 36 years old. What should I be looking out for? What should I be screened for that I haven't thought about? That may be one way to open up the conversation. But as a rule of thumb, there's also the USPSTF's website. It's the United States Preventative Task Force. And their goal, again, is to help people in the United States to prevent chronic illnesses, potentially preventative diseases. And they put out guidelines of who needs to be screened when. So if you don't know where you stand, you can see what did they say about a 35-year-old female, African-American, whatever demographic, what do they recommend that I do for my age group? But between your physician and the resources in your community, no matter where you're located, there is someone that can help you. You just have to look it up or show up to the health department. If all else fails, I always tell patients or people I meet, just go to the health department. They'll get you in the right place. Yeah.
And you just said that, and I think I said that before. I was in between my insurance. I was about to get my insurance, my new insurance, because I got a new job at the time. So I actually Googled like free clinics or women's clinic, and that's how it came up. I think it's in Decatur, Georgia. And basically there, I think it was just $25. to
Mm-hmm.
get your pap smear done. And that was
Mm-hmm.
that first step. So it was just, yeah, we can screen you for $25 and whatnot. So that was because I didn't have insurance at the time, because I was in between my insurances. So
Yeah. And anyone who's had a pap smear knows that that's a nominal fee, right? Like compared to the actual price of getting the procedure.
mhm.
I want to piggyback on both what Nina and Anna said, which is if you have insurance or don't have insurance, I think a lot of people, and I speak for myself, where I finally got an OB and a primary care physician in the last year or so. I learned from having a child is you take your kids to the doctor every year, they have an annual physical, and somehow adults don't do that. And so if you can get an opening, try to schedule them around your birthday if to make it really easy to remember. Is
Mm-hmm.
just make a commitment to yourself, like I'm celebrating life, and what better way to celebrate life than to make sure you're doing good in every area. My OB asked me why I came to see her. I said I'm trying to be an adult and schedule my exams every year, so that's why I'm here, because I play games with my health. Like there are things that I know are clearly off, but I'm just like, whatever. But in the last several years, listening to Anna's story today is reinforcing that. We had Sydney talk about, his wife Amabel passing away from what seemed like a headache. And so having all of these stories in my subconscious currently, I'm doing baby steps to behaving like a mature adult and scheduling my exams. But like, if you cannot remember or you're a little reckless, try to schedule them around your birthday so that every year as you celebrate your birthday, you also have a built-in reminder that these things are important.
That's a really
It's
good
amazing.
point. Yeah.
Yeah, I agree.
All right. Well, thank you, ladies, so much for joining us. Our audience, I know this has been a longer than usual episode, but I think every single minute, was so valuable. I know I've learned a lot, and I hope that the listeners and the viewers have learned something too. You can find Anna on Instagram at Anna Either Way.
No.
And your Instagram is not private, right? It's public.
Well, it's private now, but sometimes I listen.
Okay.
It
Well,
depends on her mood.
Depends on my mood.
you
But it's okay. Follow me and you ask, DM me and it will come to my DM and I'll see it.
Okay. Well, Anna is open. If people have further respectful questions, you can find her on Instagram at Anna Either Way, ANNAEITHERWAY. And Dr. Nina Loom is on Instagram as well at Dr. Nina Loom. That's DRNINALUM and IMG Roadmap. If you're watching this on video, it's right behind her there on the screen. And that's at IMGROADMAP. And we, of course, are 2Bs in a Pod on Instagram at 2Bs Pod, on YouTube at 2Bs in a Pod. October book of the month, Crown of Thorns by Linus Asong. My favorite book of all time. We're going to be discussing that on the next episode after this. All right. Bilala, take it away with our proverb this episode. Until next time.
Character no di make nyanga for pussy domots.
I don't me make nyanga for pussy dodmot.
Domots. Nina.
Domot na which one?
Ajabot.
No. I've always had that quote, the Aratane make nyanga, and it ends there.
Oh, that's not a complete.
No.
You
It's
can
a
make
sentence.
nyanga, but don't make nyanga for pussy.
Don't make nyanga for
domot.
pussy translation. A rat does not act funny
So-
or what's
yeah.
nyanga?
Doesn't like strut. Doesn't
It's
strut.
not stunting. It's not like stunting
Yeah.
in front of a cat. Like you're not a rat is not gonna stunt in front of
Yeah.
a cat. Like your
In
life
front
is
of
in
a
danger.
cat's
What are you
door.
doing?
Yes.
In front of the cat's door, like what are you doing? So yeah, Anna and Nina, what is your interpretation of that proverb?
What's the life lesson?
Sorry, say
Just
what that
asking
means
deep
again.
questions.
Arata no di make nyanga for pussy domots.
So the rat is not strutting. It's not going to strut its stuff in front of the cat's house.
Yeah. You're not going to what's it called? Play in the face of danger or something. Right?
Exactly.
Yeah, exactly.
I think for me, like the proverb.
Don't dance in
It's
the
like
face
F
of
around.
danger.
It's like F around and you get found out. You know what I
That's
mean? Like
true.
if you keep messing up,
True,
I'll show you.
that's
So for the cats, for the pusino, like, don't mess around next to me. I'll show you. So
I'll
I
show
also
you,
look
but
at it that way too. It's not only the arata that should be important. The pussy too. The pussy is like, if you F around, you find out.
that's true. That's true, right? So there are two ways of looking at it. If you are in the perspective of the errata of the rat, you gotta be careful,
Yes.
right?
Yes.
Don't play in the face of danger.
Yeah.
And if you are the cat, the people that are dancing in front of you, make sure when they
See,
F around, they
and
find
Anga,
out.
this
They'll find
ties
out.
back. This ties back to the conversation we had last week where I said I'm an inherently petty person. So if you come dealing with me thinking that I'm gonna be the bigger person, I don't know that word. When you go low, I'm going under the floor. So know this,
That's
no
it.
peace.